Look at these funny looking P waves. You can see that they're almost like sharp at the top. Well, this is actually called cor pulmonale. Let me show you why this happens. Okay, so when it comes to the P waves, we know that we're talking about the atriums in particular, okay? The atriums themselves are where the P waves are kind of having the depolarization. Now, why do we get these pointed looking ones, or why do we call this cor pulmonale? Well, it's actually in the name, because what we can think about is the pulmonale or pulmonary. So when it comes to these sharp looking P waves, it's actually due to strain on this right ventricle. And that strain comes from poor flow in the pulmonary circuit. So for example, patients that have COPD and they have poor flow inside the pulmonary circuit where they're trying to get oxygenation, well, that's going to have a backflow of problems in the right ventricle and ultimately in that right atrium as well. So it shows up as right atrium enlargement, shows like this, and that is where you get cor pulmonale. Thousands are raving about our best-selling 100-patient scenario book, and so we started creating the expansion books to go along with it, including the cardiac arrest scenarios, we have the airway scenarios, pediatric scenarios, and the MCI scenarios. And you can get this entire bundle at the link in our bio.